I'm here at Pediatric Alternatives. It's a pediatrics practice in Mill Valley, California, where physicians recommend foregoing some vaccines and delaying other ones.
We're just messing with nature. We really don't know what we've created.
Today, I'll be speaking with Dr. Stacia Kenet Lansman, the head pediatrician here. Can you tell me a little bit about yourself, your background as a doctor?
Yes, I trained at Tufts University in Boston and did my pediatric residency in Oakland at Oakland Children's Hospital and then moved to Marin County. In 1998, I started Pediatric Alternatives in an effort to create a practice that focused on health and not on illness.
Let's talk a little bit about the vaccine policy. What is the vaccine policy here?
We have a very open-minded vaccine policy at Pediatric Alternatives. My personal concern is that babies are getting too many vaccines at too young an age. And so what we've decided to do is look at each vaccine individually and look at what diseases are actually prevalent in the community and then decide how to vaccinate. We've been doing this for 16 years. I've never had one patient get a serious life-threatening vaccine preventable illness because we gave them a vaccine at a later date.
Okay, let's talk a little more specifically about which vaccines you recommend and when you recommend them for.
Okay, so the vaccines that we recommend in the first year of life are for the diseases that we actually see in the community and we feel like are serious illnesses. The most prevalent disease that's vaccine preventable, at least in theory vaccine preventable, is pertussis. We've seen a big rise in pertussis nationwide over the last several years. We do vaccinate with the DTaP, which is the vaccine for pertussis or whooping cough. The other two vaccines that I think are important to do in the first year are the two vaccines for meningitis.
And then let's talk a little bit about the MMR vaccine.
The MMR vaccine is recommended at 1 year of life. We postpone that vaccine in this office. There has been a question of a link between the MMR vaccine and autism, although the mainstream medical establishment has disproven this claim. My feeling is that if there's any risk that the vaccine is associated with autism, that we should delay the vaccine during this vulnerable developmental window. So our practice in this office is to give the MMR vaccine at around 3 years of age. Anecdotally, there have been enough reports, even in my own practice, of parents of children with autism who feel like that they developed symptoms after the MMR vaccine, that I'm not willing to risk it. Nobody wants any child to die from an infectious disease or a vaccine preventable disease, but basically what I'm trying to say is there's a fear of illness that I think is unnecessary. While some of those diseases can be serious, they also do challenge the immune system in a way to strengthen it, is my belief. And I think we don't need to be so afraid of some of these illnesses.